I'd like to begin this presentation by acknowledging the traditional custodians of the lands on which our work takes place, the Wurundjeri Woiwurrung people of the Kulin Nation, and pay my respects to the elders past and present. My name is Kat Thorne and I'm a Health Promotion Officer at Merri Health working on the Ready Set Prep initiative, which I am here to tell you about today. Ready Set Prep is a place-based collective impact approach to supporting early childhood development and improved life outcomes for children and families in the northern suburbs of Melbourne, Australia. Today I'll be talking about the aspect of upskilling community champions to support service access for children and families. The Ready Set Prep partnership first formed in 2017 based on the results from the 2015 Australian Early Development Census, or AEDC. These results showed that 37% of children in Fawkner were starting school developmentally vulnerable in one or more of their developmental domains. This could be physical, social, emotional, language, or communication. This statistic was significantly higher than the municipality, state, or national proportions, which were sitting much lower, around 20%. 4 years of initial funding was provided to the Ready Set Prep partnership by philanthropic organisation, the William Buckland Foundation. Over these first 4 years, Merri Health worked mostly with the 5 local primary schools in Fawkner, focusing on 4 key activities. 1, organisational development approaches to improve transitions and create more welcoming and inclusive schools. 2, establishing a transition network or community of practice for teachers. 3, the employment of a family engagement officer who worked directly with families, linking them to services and supports. And 4, sharing key messages about early childhood development and local services. This included the development of a co-designed video series featuring local people, places, and faces. Within this last activity, 37 stakeholders across 13 organisations and 60 Fawkner families were involved in developing key messages for the videos. A further 110 community members and stakeholders from Fawkner were involved in filming and refinement of the videos and accompanying illustration. This helped highlight the importance of child and family voice and the key part of the puzzle that had been missing. At the end of 2020, we were awarded a further 2 years of funding, this time from the Helen McPherson Smith Trust. Coupled with our core funding from the Department of Health, this allowed us to employ a dedicated bicultural community engagement officer, facilitating a big shift in our work to become much more community-centred rather than partner-driven. It was also a great chance to conduct a thorough evaluation as well as community consultation to increase our focus on community-led work. One of the first consultation activities actually occurred with children, with parents supporting children to share videos where they let us know what they wanted to know about starting school and what they wish they knew before starting school to tell the new students. Other activities happened with parents representing their child views, and overall we reviewed 28 most significant change stories, interviews from 157 community members and 23 service providers, population level data including the national academic measures of the 2018 AEDC data and NAPLAN, and attendance data for preschool and maternal and child health checks. As part of this next phase, a representative steering committee was formed, comprising of members from local schools, early years, local services, and community members themselves. We also redesigned our entire governance structure with community represented at all levels, and I'll touch on this a little more later. This model has ensured that community voice and lived experience are included in decision-making, with all resources, key messages and local solutions that have evolved from Ready Set Prep having been co-designed with stakeholders and community members. Based on all of this, the steering committee made a couple of significant changes leading into phase 2 of the initiative. Expanding the initiative into 2 neighbouring suburbs, Glenmarie and Hatfield, where the AEDC results were getting worse, despite improvements in Fawkner in the 2018 collection. Growing the partnership from 5 initial partners to over 40 partners, broadening the initiative to focus on birth to 6 years rather than just the school transition age, and adopting a much greater focus on engaging with community and authentic co-design. The steering committee also worked together with Clear Horizon Consulting to develop a draft theory of change, or the roadmap of our activities. You don't need to see the details, as I will highlight the key parts. This model was then tested and refined at 3 community workshops with 36 community members. To complete this piece of work, a working group of community members came together to develop the vision up the top, which complements the goal of more children and families in Northern Marybeck are school ready with improved early childhood development, wellbeing and life outcomes. 7 interrelated key activities help to support this aim, with work happening across the community environments where children live, learn and play. Today, I'll be focusing on the activities that involved community input into increasing service access and knowledge. Firstly, our community champions work. A desktop review was conducted of existing community leadership peer models, and we chose to use the boundary spanning community connectors model. Identify, connect, and enable. So identifying comprised the wide promotion of this opportunity, as well as targeted approaches by the community engagement officer. Subsequently, 10 community members from 6 cultural backgrounds formally submitted an expression of interest and were engaged in the role. Connecting included introducing the community champions to each other, as well as to Mary Health. Importantly, expectations of both parties were outlined and the community engagement officer conducted regular group and individual check-ins to support relationship building. And enabling involved sharing key messages and providing regular training opportunities offered by Mary Health and other providers. This included tailored training to become peer facilitators, such as around dental health and parenting for migrants. Community champions were also invited to participate in community engagement activities, such as attendance at local community festivals and school holiday activities. Since beginning this model in July 2021, all 10 community champions have been retained. Possible supporting factors include reimbursement for their time via gift cards, being able to bring children along to face-to-face training sessions, and seeking input into the best time to hold sessions. Additionally, there was mutual benefit to this work for the organisation and the individuals, so I'll just run you through some other results. Quarterly surveys were used to collect data as well as check in around expectations. Pre and post surveys were also conducted to examine overall impacts, and from this we found that for connecting, 100% of community champions agreed or strongly agreed that participating in community champions had increased their social connections and sense of belonging. Community champions reported a very strong relationship with Mary Health, with an average score of 4.7 out of 5 as an entry into services. Community champions collectively reported a 160% growth in contacts at settings they visit, such as schools, kindergartens, playgroups, health services, and online groups such as WhatsApp. And community champions were recognised by other organisations such as local council and libraries and were asked to share information. For enabling, community champions report sharing information with over 2,000 community members per quarter, of which 400 of these were new each quarter. 100% of community champions agreed or strongly agreed that the training and key messages shared were beneficial and increased their confidence to share key messages. 100% of community champions agreed or strongly agreed that they had contributed to changes in services, and 89% agreed or strongly agreed that being a community champion had increased their ability to be a leader. Community champions were also supported with ideas they had. This resulted in 2 grant submissions and 1 women's social group and 1 play group for children with autism being established. The 10 community champions were also recently recognised for their achievements at the local council Marybeck Awards. We also conducted qualitative interviews with the champions who were willing to participate. Many of them mentioned that sharing ideas had been important, as well as connecting with others, increasing their knowledge and developing professional skills. They said, "I love being a part of this team. I feel we can achieve so much working cohesively as a community. It's wonderful being part of the Community Champions program, meeting with great community leaders with one goal in mind, that is to help other members in our community." Some people involved as community champions were also part of working groups, which make up part of the governance structure. So I'll explain this a bit more. Working groups are a decision-making body and are a key strategy to focus in on complex factors that create barriers to access for local children and families. These groups, who are made up of service providers and community members, have then been able to identify local solutions, creating a sense of ownership. Specific areas of focus for the working groups have included developing the 10 key messages, planning a school readiness workshop, addressing a school starting age queries working group, and increasing attendance at key health checks such as child dental and the 3.5-year-old maternal and child health check. For example, this last group involved a multifaceted approach, including 40 kindergartens and schools, including a tick box prompt and QR code on their enrolment forms, creating a simplified webpage to request a callback to book an appointment, and sharing a short video introducing the friendly maternal and child health nurses and dental team and services they provide. The working group structure was evaluated alongside the steering committee as part of a review of community-led governance. Surveys and semi-structured interviews with representatives participating in the governance structure highlight that this has built community trust, leadership, and empowerment. This review found that of the community members and service providers involved, 100% agreed or strongly agreed that community-led governance made decision-making more informed, resulted in better use of resources, and was reflective of community needs. And 92% reported that working together had improved outcomes for families in the local community. And I've left some quotes there on the screen. To help us measure our work as we move towards the goal, we have looked at indicators along the way, as it can be tricky to measure long-term population level systems change. This includes tracking outcomes in relation to work occurring with services, parents and carers and children, some of which we have highlighted while running through the activities. For this, we have combined quantitative data with community stories to capture the benefits of community leadership and co-design. We have shared some quotes around this on the screen, as we've already shared some of the quantitative information as going through this, but just a little more to have a read of there. These local indicators and stories are pieced together with the 2 AEDC data collections that have occurred since the start of Ready Set Prep. In 2018, positive results saw less children starting school experiencing vulnerability in Fawkner, from 37% to 26%. This resulted in the expansion to Glenroy and Hadfield in the second phase. The release of the 2021 data is the first AEDC release since the beginning of the pandemic, and is an important snapshot of the wellbeing and development of local children and families after a difficult 2 years. While disheartening but not surprising, these results showed a higher level of families experiencing vulnerability on 1 or more domain in Fawkner and Hadfield, and 2 or more domains in Glenroy. We therefore acknowledge that there is continuing need for this work. However, time-bound funding was both anticipated and planned for. Over the past 6 years, Ready Set Prep had aimed to create sustainable change beyond the life of the initiative. This includes strengthening partnerships and relationships, developing accessible resources for consistent messaging, and increasing community capacity and leadership. This has been combined with the tailored solutions developed to meet our local community need, particularly during the challenging times of the COVID-19 pandemic. Given these challenges, we have recently received funding from the Australian Federal Department of Education for COVID recovery work. This will allow us to review our work as we shift the focus to children in prep to grade 2, as the children who missed out on face-to-face learning in kindergarten and early primary school over the past couple of years. With this, we'll be taking some lessons that I wish to share. 1, supporting community input and leadership can result in greater engagement and ownership with activities, and the co-design processes themselves were important for supporting engagement and developing relationships, helping Ready Set Prep and its messages and programs to be recognised in the community. 2, monitoring a range of indicators is useful to help show if we're on track, and also allowed us to celebrate small wins to maintain momentum. Additionally, it allowed us to learn by doing and reshape the focus of the initiative, which is particularly handy during a pandemic. And 3, finally, our approach has many activities and soft entry points, meaning that there is no wrong door and families can become engaged in the way that is appropriate for them. Thank you.